From age 20 to age 30, you have a window of opportunity to achieve your highest possible lifetime VO2 max. Whether or not you achieve your highest potential VO2 max in your 20s will largely determine how aerobically fit you can be for the rest of your life. You will essentially set the high point on your lifetime VO2 max curve. Hi, I'm Dr. Maria Conley. Your relative VO2 max tells you about how much oxygen your muscles are able to use per minute to make your body move. Oxygen is delivered to muscle via the blood. If you multiply the amount of blood that your heart pumps in 1 minute, this would be your cardiac output, by the amount of oxygen that your muscle is able to extract from the blood, this would be your arterial venous oxygen difference, you will have your maximal oxygen consumption, or VO2 max. VO2 max is expressed in milliliters of oxygen per kilogram of body weight per minute. Your VO2 max is, in some ways, like the horsepower of a car's engine. If your body's engine has a higher VO2 max or horsepower, it will be able to consume more oxygen or fuel before developing fatigue. Essentially, you get one chance in life to choose how powerful your body's engine will be. Assuming that the power of both engines will decline at the same rate over a lifetime, would you rather start out with a 1600 horsepower engine of a high-end sports car like a Bugatti Chiron Supersport, or with a 78 horsepower engine of the rather wimpy Mitsubishi Mirage? Attaining your lifetime VO2 max and fulfilling your genetic potential in your 20s is like choosing the most powerful car engine with the highest capacity for fuel. That's going to be with you for the rest of your life. Your VO2 max peaks between age 20 and age 30. From this high point, it declines at about 10% per decade after age 30. The rate of decline in VO2 max is about the same in everyone, from couch potatoes to Olympic athletes. However, fit individuals who are able to attain a higher VO2 max at age 25 will start their decline from a much higher peak. Although a fit individual's maximal oxygen consumption declines at about the same rate as the rest of the population, their VO2 max will always be higher than that of a sedentary individual of the same age, just because they started at that higher peak value on their VO2 max curve. If you achieve your highest lifetime VO2 max in your 20s, your VO2 max curve may never drop below the frailty threshold of 17.5 milliliters per kilogram per minute at the end of life. Once your cardiorespiratory fitness level drops below this threshold, it becomes unlikely that you'll be able to live on your own without help. This may be the difference of living your life, the last 10 years of your life, in a nursing home versus staying in your own home and living independently and having a better quality of life. By becoming aerobically fit in your 20s, you make a big investment in yourself that pays off in dividends later in life. What will your VO2 max curve look like? Thank you for listening. I hope that this was helpful for you.